As the world gets more technologically advanced, there is another tool to help doctors more accurately place robotic knees. Now doctors at Illinois Bone and Joint can offer a faster recovery time to patients, fewer scars, and much more. I spoke with Dr. Sean Sutphen to learn more.
When I decided what I wanted to do for a living, my goal in life is to help people, and I found there's no better feel in helping people in terms of getting them back to their quality life and doing the things they want to do. My specialty is hip and knee replacement surgery. I also do partial knee replacements. My main specialty is working in robotic type surgery, as I feel it's very precise for the patient. There's a lot of misconceptions when we talk about robotic hip and knee replacement. Patients think that the robot is doing the entire surgery. It's actually very similar to traditional hip or knee replacements. So when we do a hip or knee replacement, we take out the diseased tissue and we restore it with implants to give the patient a stable knee. And essentially what the robot does that is different, it's a customization for the patient. So every patient's anatomy is so different. And so what we're doing is we're able to get a 3D dimension prior to the surgery, and allows for each step in the surgery to be very precise and customized to fit each patient's knee. We've seen by putting the components in the most optimal position, that being in the best space they can be in the knee, to give them the most optimal alignment, allows for patients to have a quicker recovery, less risk of complications, and that's what we're chasing for all patients. All we want for patients is to have a great outcome, get them back to where they want to be. In the world of orthopedics, on top of robotic surgery, we've essentially really moved into the outpatient sector. And what we found is patients recover better at home. Outpatient joint replacement in surgery centers, for example, patients go home the same day, and it's a phenomenal experience for the patient. You don't have to stay in the hospital overnight. It's much more financially better for the patient, and you get back to your home quicker and you recover faster. We use essentially much more rapid recovery protocols to get you moving quicker than staying in the night in the hospital. This, coupled with the robotics, allows that patient to get to that next level quicker.
You did great with your surgery. We're on your way to recovery here, Kathy.
So what we do is you have a knee replacement or hip replacement or a partial knee, and within an hour you are up and walking with your own personal physical therapist. It's a great experience. Patients are moving right away, they're gaining confidence right away, and then they're going home, and we have a nurse and a therapist come out to their house so they do not feel alone. And again, we check on the patient thoroughly while they're at home and get them back to recovery and in a much more rapid pace. IBJI is a wonderful place where we have really instituted our core values is to get our patients back and get them moving. We're a great group of physicians and leadership and physical therapists, nutritionists, dietitians that are really striving to get our patients back to doing the things they want to do. And that's why we do this. And at the end of the day, getting back to spending time with their grandchildren, taking long walks, getting back on the playing field, doing the things they want to do, that's why we do this for a living.
All right, grab those phones and scan the QR code on your screen for more information about Illinois Bone and Joint Institute. You can also visit IBJI.com to make an appointment or give them a call. The number's right there on your screen.